Hey guys, I'm Max6. So today I'm actually taking you along with me to go see Dr. Rand. We're actually going to do a little ask the doc questions, and also I wanted him to go over this whole situation and get from an actual doctor his take on it, and you know, without all the bullshits from the social media or negative news and all that stuff. So I'm hoping he'll be able to shed some light on what's going on a little bit, get his take on it, and hopefully you guys enjoy the show. And that's it. It's beautiful here in Santa Monica this week today. Clear blue sky. We're gonna get in there and see Dr. Rand and see what he has to say about this whole thing. Thanks for watching, and make sure to subscribe also. Thank you. All right, you guys, as promised, I am in Santa Monica with Dr. Rand, and I've waited for this one for a while, because last time we actually saw each other, Dr. Rand, it was right before I was supposed to leave for Columbus, and I came to see you to say hi, and I was telling you they just canceled the expo, and we had a little conversation about it back then, and then you were traveling for a little bit. You came back on the 27th, and here we are. We're just second day of April right now, and I just wanted to excuse me, get with you to get your take on this whole thing right now. Because there's so much information through social media, through the news, and a lot of bad news and a lot of confusion, I think, for people. And I said, you know what, I want to go see Dr. Rand to see what his take is on this whole situation that we're currently dealing with right now, because I figure whatever you'll tell me is what I'll believe. And I think people need to hear from someone who's actually in the medicine industry, what the real time is, so that's why I wanted to come today. And you look great. You told me you put on 20 pounds. You're still doing consultation at the office. People can still reach you. Actually, it's funny because yesterday or the day before, someone from Canada told me, "Oh, is Dr. Rand still doing consultation?" I said, "Yeah, he does Skype consultation all the time." And so I guess you've been following up with your patient through the internet and through phone and through Skype, and you're still working quite a bit.
Yeah,
actually.
No, we can consult through the telephone, and through Skype is even more preferred. And that makes it a lot easier for us. We're very blessed in that regard, that we're not missing a beat. More importantly, our patients aren't missing a beat in terms of staying healthy. And I appreciate the kind words. I want to harp on one thing you said, which is, social media. Stay off of social media if you want to try and get some information about the virus. There's so much misinformation, not just on social media, but on the internet in general. And while I'm not an epidemiologist and I'm not a viral pathogen expert by any means, there are some basics that you should probably know before you start wading into what's out there on the internet, and certainly with social media, which comes with a bias. Use social media for what it's for. Find out what your buddy what is, you mean face brag? Find out what your buddies are doing out west or out east or wherever you are, and have fun with it that way, but don't use it as your medical source. And I've often had discussions with patients about using Dr. Google, the same. I mean, you should have some background before you start investigating. One of the ways I try and explain that to people is, in medical school, when we start reading this stuff and we're green, we don't know what we're doing. We just got into medicine. You start reading about different diseases, and suddenly you realize you've got all these diseases because you start reading about symptoms and without knowing any more information than, okay, I mean, the example I use is hopefully funny. A headache, fatigue, nausea, some bloating, some abdominal cramping perhaps, and you go, oh my God, that's me. I've got it. I've got PMS. And yet I'm a male. It could also be because I drank too much last night and I've got a hangover. So that's the danger with going out there and starting to pick this stuff apart without having some background. And it's understandable. It's not pointing a finger, but boy, it can lead to so many problems. Just like with bodybuilders are guilty of the same thing. Putting things together that don't necessarily mesh and getting into trouble sometimes. So I think our team put it on, of all things, Facebook, just because it was trying to counter some of the stuff that's out there, but also to all our patients we emailed some good sources for information that are available, so you can go and it's been distilled for you So it reduces the chances that you'll make some inferences that you probably shouldn't. But Johns Hopkins University has on their website some very good information that's covering the so-called COVID-19. The University of California, San Francisco issued a, for lack of a better word, a bulletin earlier, I think it was in March 10th, somewhere around there, which had some very good information, both that was relevant for the time, but moving forward. And there are others. I mean, the CDC has done a wonderful job of keeping it up to date, the information that is, and keeping it relatively simple. So there's some good sources. Just stick with those. The problem with all this is there's a lot. It's in the early stages, and there's a lot of data that has to be culled. First, it has to be collected, and in the early stages. There's not enough to go on to make generalizations moving forward. Trends are hard to come by in the early stages. These are some of the obvious things, but there's also a lot of what we call noise, statistical noise going on. And there may also be biases, but we're not going to be able to figure all these out until post facto. 2-3 years from now, we'll look back on this and go, oh, look, here's pretty much exactly what happened. For example, one of the problems that comes up, you look at the Italians and how much disease and death has occurred there, but one of the possible explanations for their country suffering more than others is if someone is wheeled into the emergency room with, say, a heart attack or a stroke or a diabetic ketoacidosis event, and they test positive for coronavirus, the cause of death was coronavirus.
I see.
Well, that's going to inflate the numbers, right?
They're blaming everything on that.
Whereas in South Korea, they may, and this has been suggested about the Italians. I'm riffing now about South Korea just as an example. They may not even test for coronavirus. The patient's sick, but oh look, they had an MI, so oh well, they died of a heart attack, a myocardial infarction. So you're going to see a lot of issues and a lot of judgments being made about these issues based on incomplete data. So in other words, you could look at that and start coming up with, well, geez, what's going on? Why are the Italians so different than the Koreans? Oh, it's because they smoke over there and the air is so bad, which might be true. But it might also simply be because of the way they're tracking the data, is my point.
That's right.
So there's an old expression with data, garbage in, garbage out, right? Right now, it's too early to tell. There are some trends we can pay attention to, though, again, with the same factors involved, where, for example, now the Chinese are being accused of not reporting any of this stuff, and that's why their death toll and their infection rate has dropped. Well, it's still there, but they're just not reporting it. Again, who the heck knows?
That's right.
We'll know 2 or 3 years from now, perhaps. But, what we can watch for is a slowing of the rate. That's important to see right now, to see if the restrictions we placed on everybody are working. So you might see more and more deaths every day, but if you see the rate slow, that's a good sign. So the car may still be accelerating on the highway, but it's accelerating at a slower rate. That's what we're looking for.
That's right.
And so far it looks like that's happening, which means that our social distancing measures, etc., are working out for the better. I'm not saying that that's the best thing that we could have done. For the record, I'm not saying it's not. We are in the position we're in right now. I know you're going to get to this in a minute anyway.
I can't wait.
I think the most prudent thing to do is follow the leader at this point, because if we don't, even if you don't think this is the best measure possible, then we're really up the creek without a paddle, because then we're doing nothing. So again, you could argue this wasn't the best choice, whatever it is that's being done, but we got to do something. And I'm fully aware of what's going on and have my own opinions. Not that anyone needs to hear about that, but we've jumped in here and decided to play arbiter of circumstances. You might want to say we've decided to play God. We do that with humans. We've stepped in here and tried to compensate for a virus that wasn't caused I don't want to get into conspiracy theories here either. But I mean, it's just, this is a fact. You know, viruses are out there in nature, and they've infected humans now, and to try and save some of these humans, which I understand, we may be hurting other humans. Not maybe, we definitely are. So, you know, I know what we talked about. We're going to get to, and I'm just jumping to it right now. Is, you know, what are the decisions we make here? I don't have the answers. I don't think anybody does, but we are finding ourselves more aware of them now because of the consequences of social distancing.
That's right.
For example, you know, to use a very poignant case, I think, what about the kid who is no longer allowed to go to school, who is so impoverished, his family is, that his only meal, and this is not making this stuff up. I mean, there was I think it was a former Miami Heat player who wrote an article about this, because he grew up not far from where I grew up, in Liberty City. Eating raisins for dinner, if he got anything for dinner. What about this kid who the only place he has a chance to eat is at school lunch, and getting some fish sticks, which, man, you know, when that's all you're getting, that sounds pretty doggone good, right?
Yeah.
And again, not to make a case one way or the other, but I think we have moved in a direction with some lack of consideration for the consequences, such as that school child. Again, I don't have the answer, but I think that's where we're headed, which is something you were going to ask me about.
Well, I'm just, I understand what they're doing right now to flatten the curve and all that stuff, and I get it. I think most people's problem is we have no clue when this is going to stop. So it's one thing to tell people, okay, this is going to go on for 2 weeks, 4 weeks, 6 weeks, then everything goes back to normal. So hang tight, you'll be able to go back to work, earn money and all that stuff. They're not telling us that. If anything, it's just, you know, first goes from, you know, school being out for 2 weeks, then 2 months, then forget it until next September. You know, it could be the same for people as well. So what exactly the long-term ramification of people not working, the economy completely going down the drain, isn't that going to be more of a problem than the problem to begin with?
We're going to find out. We're going to be the first to find out, aren't we?
That's what it is.
We don't know the answer to that, and we're playing it by ear, you know, shooting from the hip. And again, we're going to be the first to know, right? When we get there, a lot of the projections, you know, I go back to what I said earlier, are based upon, you know, again, this garbage in, garbage out. It's too early to have enough data to get a model in place. We don't know enough about the virus, for example, to be able to model it accurately. We can, again, I'm not knocking what epidemiologists are doing. We're doing the best we can. I firmly believe that. I don't think there's a bunch of conspiracy or bad guys out there. It's just to place, and I'm not saying we have any better choices either, so I know this makes it hard, but to say with certainty anything right now is too early to be able to do that. And it's not to take away from the efforts to do so, is I guess what I'm trying to say. But yeah, is it going to be 2 more weeks? Is it going to be 2 more months? Nobody knows for sure.
Yeah.
And that's part of the problem. But so we got to stay fluid, and we have to be able to adjust as best we can along the way and say, okay, it's gone too far now. If you do some other projections, for example, with some statistical modeling, how much is this, for example, economic crisis going to affect that school child, the people that, you know, other children, let's stick with that theme, that have to go home and maybe face some domestic violence because they can't stay in daycare.
That's right.
But also the economic impact that we've always kind of overlooked in comparison to, you know, maybe helping someone survive with COPD and diabetic issues for another 6 months. I mean, how do you put a price, and this is where it gets really difficult, right? On 6 months of life, where it can be easily measured on the back end. Okay, it's pretty easy to determine this guy or gal had maybe another year left of life, just to use an example, versus this 6-year-old who has
his whole life ahead of him.
Presumably a heck of a lot more life ahead, you know, and how badly that's going to affect them. If it doesn't kill them, but it's going to affect them and affect their quality of life. And we're getting some pretty philosophical questions for which I don't think anybody has the answers. I think we're going to have to go on some gut here, right, as to at what point we say, okay, enough's enough, and we got to start phasing this in. But this gets to another point, which I'm excited is one word, but frustrated in other words, that we haven't gotten more news about it. We haven't made more of a big deal about it. We're focusing on treating people right now, which we should, and we're also focusing on vaccinating people down the road. That's, a year and a half, arguably, down the road before we'll be able to protect people in that regard. But in the interim, in that middle ground, I don't think we're taking away from either one of those by getting these antibody tests out there. I was just reading today that Celex has come up with one, and there are others out there. You can look at the FDA-approved ones under emergent approval processes. Some of these antibody kits, rapid testing kits are out there. Why are they so important? Well, they can help alleviate some of the problems that are occurring with these issues we just discussed. For example, if I can give you an antibody test that shows you have antibodies called IgG, which are different than IgM, immunoglobulins G versus immunoglobulins M, showing that, hey, you've had the virus, you've been exposed to it, and your body is beyond the early stages and you're now past infection and the ability to infect others, to pass this virus on to others. You have IgG present, this immunoglobulin that's a long-term antibody. It's the same antibody type that we're trying to induce when we give someone a vaccination, so that your body is prepared to mark this, they call it an antigen, with an antibody, so your immune system can track it down and destroy it, okay? But if we can identify you as someone who's had that, then if you're a healthcare worker, not only can you go back to work without being stressed all the time about being infected, but you don't use the resources that someone who hasn't been infected, who's working along beside you, needs, okay? You can, if you're not a healthcare worker, which I would argue should be the first people to be tested because they're in the trenches there.
That's right.
If you're an essential worker, a public transportation driver, a grocery store clerk, whatever it is,
an essential.
They're using essential workers. Then if you know that you've already been infected, because 81% of the, depending on who you believe, 81% of the people who have been infected with coronavirus get mild to moderate symptoms. So mild, in fact, in some cases, that people say, "Yeah, I had a sore throat for a couple of days, but that's all I really knew."
Yeah.
These people can get back in the game. They can get back to work and stymie some of this economic fallout that's occurring from staying home.
So that's a very good point right now that you're making, because we have to move forward at some point. It's not logical for people to ask to stay home for months. Some people will have to go back to work if we want to continue.
Arguably for a year and a half until we develop the vaccine.
Exactly.
Right? Unless we can determine who's gotten it already, aside from this other form of testing, which is PCR testing, which, without getting into specifics, very, very sensitive way and specific way of testing. Hey, do you have the virus already? Well, if we get a positive test there, and of course accompanied by symptoms, we go, okay, well, we already know you got it, and eventually, you can go back to work. And they could use that very expensive and time-consuming, relatively speaking, testing to determine at some point, hey, you no longer have any of that virus present, now you go back to work. Or you can use this much cheaper method. And obviously, without rehashing all that, from a different angle, where you don't already have a population that's been identified as having been infected. These are for that other group that we don't know yet. Again, maybe, I did kind of feel poorly a month back or so, but I heard, coronavirus, people are dying of that. I didn't think I had that. Well, yeah, maybe you did. And we can get you back in the workforce.
When this first came out, excuse me, when this first came out, they were saying, just like you said, that 80% of the population had low to no symptom, some moderate, and some people, of course, died from it. We know that. But they were saying that most people affected were people with compromised pulmonary issue, and also elderly. I'm hearing more in the news that some people that are in their 30s and 40s are actually sometimes getting sick, and supposedly we're in good health. And are you hearing any of this stuff too? So is it across the board now?
Now you're highlighting what we were talking about information and misinformation.
So it's bullshit? Okay, good. Because I want to ask.
It's not necessarily bullshit. It's just it's preliminary data.
So we don't know for sure. That's why maybe they were just going to get sick anyway. People get sick all the time, whether they're 20, 30, 40, they die all the time. That's your point.
Well, preliminarily, the data suggested that, it was mainly elderly.
Right.
No one under 19, remember, was getting it. Then all of a sudden, now we're seeing some people in their 50s getting it. Now we're seeing some people in their 40s getting it.
Yeah.
Healthcare workers in their 30s were getting it. Now, is that because of their age, or because they're getting, repeated exposure, or because all the preliminary data that pointed to the elderly only was not really accurate.
Right.
That's the kind of stuff we're going to find out 2 or 3 years from now.
Okay.
Maybe sooner. More accurately, we're going to say, oh, well, here's what really happened. And it's interesting because when I read this stuff, you read about cases, and people will even write an article, and assuming they're not full of it, they'll talk about their own experience. It's interesting to see whether or not the past medical history has even been included. It is important, duh, but how many of these cases of, say, a 30-year-old getting the virus did not include the fact that, oh yeah, by the way, I have diabetes. Or by the way, yeah, I'm one of the biggest factors in this country they're determining is obesity. You don't see as many obese people, herding sheep in Italy, right?
Yeah.
Their issue may be that they're herding sheep and smoking a lot of cigarettes. The issue here is, we're not getting our exercise. We may not be smoking as much, but we're sitting around and getting fat, and that's a problem too.
Yeah.
It's hard to breathe, hard for your body to do the right stuff when it's considerably overweight.
That's right.
So anyway, these are all factors that sometimes get included in the dialogue or the presentation, sometimes not. It's too early to tell, but you can go back and say, well, these are some obvious ones, right? I mean, we know smoking is not good for your lungs, and if this thing is settling in your lungs, which it is, then that's obviously a strike against you. Obesity, diabetes, COPD is an obvious one, again, for the lungs. Hypertension.
Mm-hmm.
These are things we know are conditions that are not going to help you in any circumstance, right? But certainly in a more intense stressor like this virus.
Okay. That makes sense. So the rules really haven't changed. It's just I think you're right. Everybody who's dying right now is just chalking all that on the virus, and that's it.
What's interesting about what has changed is that we've had the flu, and people point to it and say, yeah, but this isn't the flu. It's worse than the flu. Okay, I agree. It's looking like this is going to take its toll on more people than the average, historical average seasonal flu. But why all of a sudden are we more worried about this than we are the others? Is it simply the 10, 15-fold, depending upon how you measure it, a relative increase in death, which I say that because it's a relative increase. Sounds like a lot, 15 to 20 more times more people will die. It's still a pretty low percentage overall. It's not half the population being wiped out.
Right. And
I'm not making light of the fact that people are getting sick and dying from this. What I'm trying to point out is, why are we suddenly focused on it? There's a lot of fear involved because it's a new one. It's not an old one. The flu that's been mutated again, which arguably is kind of the same thing in that it's mutated. So it's not what it was last year. Yeah, but we know it's kind of like that. Okay. Again, we're talking about emotional reactions, I argue here. We've got this coronavirus. Well, we've had coronaviruses before. We've got about, the typical person, I think we've identified 5 in our history so far, of which most of them are, I don't get into technicalities, they have letterings attached, alpha, beta,
right.
But they're relatively mild. Why is this one kicking our butt so much?
Why?
And why aren't they? Why? In what ways are they similar? Which ways are they different? The ones that have kicked our butt before are the SARS in the early 2000s, and a little bit later the MERS, right? The death rate was a lot higher, for example, with MERS, but the absolute count wasn't that high. It was largely localized, right? In Saudi Arabia and places where they had camels.
I see.
And I'm just kind of spewing at the mouth here because I don't have the answers, but it is interesting to observe. Like, this is a very drastically different reaction to 60, depending on what you read. And I'm going to get the numbers wrong, but estimated deaths, because again, we estimate every year because we're not sure. Because when someone comes in and they die on the table of a heart attack, but before they got there, when they were having chest pains and difficulty breathing, we test them for flu, and they were positive. Well, was the cause of death listed as flu or heart attack?
Right.
So we have, and I'm going to get it wrong, but let's say 30 to 60,000 deaths last year from the flu. Well, how come we didn't get our panties in a bunch over that? That's a lot. Look at how many people have died so far. Now we're estimating a lot more than that, but again, we're getting that estimate thing.
That's right.
And we'll know more in a year or two from now if this was warranted or not. To this, or I guess that's not the right way to put it, but we'll have a better handle on why this was we reacted so much differently than the other.
I think social media is to blame, and the news, to be honest with you. I think people now have the power to just spread, whether it be good news or news in general, themselves. So it's like a wildfire. And I think the media is not helping at all. I don't think they don't want to report good news. We know that. Reporting good news and puppies and rainbows, that doesn't sell, that doesn't create viewerships.
Yeah, well, I was having that discussion earlier today too, and I don't believe it's necessarily a conspiracy at all, but it's the way the world works, right?
That's right.
If you're going to make more money,
that's right.
Because this story captures attention more than the rainbows and puppies
That's
story.
right.
I get that, and I'm not proving it or disapproving it, but there's more to it than the media too. I mean, you could argue that the scientists they carry some responsibility too, because while they could supply these models to the public and to the politicians who are asking for them,
right,
they could add a caveat or a disclaimer, however you want to put it, and say, hey, this is worst case scenario. This is only a window. I can't give you accurate information yet. I can give you what the model I made thus far based on this limited data and all
right.
this noisy stats, what the high and the low is, and then you take it from there. Remember, these scientists are the same ones that are dependent upon grant money.
Mm-hmm.
So there is some. I don't want to paint a conspiracy theory, but there's some natural back and forth between politicians and scientists that can be self-serving for the scientists and the politicians both. So, and again, I'm not pointing fingers. I'm just observing where these numbers and all these admonitions about what to do or not to do come from.
Yeah.
Again, it's quite natural. It doesn't make it right, but it explains where we are today.
That's why I wanted to talk to you. And what can people trust today? Obviously, not the news, or not all news. What people really want to know the real story, and they want to be informed, yet they don't want to be hysterical and panic and
trust your intellect and common sense. The things that are interpretive, put in one bucket. That's subjective. Somebody can interpret that data. The other bucket is the stuff is fact. For example, when I say fact, you assume that the data that are collecting is not made up. Someone's not going and saying, well, I really feel like calling all those hospitals today. Let's just make up a number that's 10% more than yesterday. Assuming that information is gathered correctly, and again with the caveat I said earlier, that you realize that information is tainted or biased by the method that hospital or that country may use to determine whether the death was caused by a heart attack or truly the coronavirus. Right. Know that there's certain information you can say, okay, this is given the biases, this is the trend. That's not subject to as much subjectivity, given what I just said, mm-hmm. as a model that says, well, okay, we'll take that data and then we'll add some more flavors, if you will, about, but what we did, what we knew about this virus and the assumption that it's going to act like this one, more like MERS than like SARS, or more like MERS and SARS than the flu, it's going to head in this direction because what we know about it. Then you get into more interpretation mm-hmm. than, one iteration away or two. You're getting, 5 or 6 iterations or two of subjectivity. Does that make sense?
Yeah.
So that's where you have to just stick with the facts. And the hardest part of all this is we don't have a whole lot of information to go on.
Yeah.
So it's hard to just sit there and go, well, I'm going to sit at home and see where this goes. That's, I think, the hardest part for the nation,
yes.
all nations, all people right now, is we're being told to stay home. And there's a lot of blah, blah, blah going on, and we don't have a whole lot of solid information. And I guess what I hope will be hopeful is nobody's fault. We're in the situation. There's not a whole lot we can do except observe and react as best we can, smartly, try to think ahead, so we've got all our bases covered. But it's not a conspiracy so much as, this is a new one, and we got to wait this one out, and we'll be able to, 2 things we can do. We know a lot more about coronavirus, like I say, 2 or 3 years ahead and we'll know a lot more about how to handle and be prepared for any kind of pandemic, whether it's another flu variant or a coronavirus variant or a bacterial infection of some sort down the road. We hope, right, we learn our lesson from this one about how to be prepared better for the next one. Those are pretty much the only two things we can hang our hat on at this point, or try to. In the meantime, we just got to be patient.
Yeah. So when you stay informed, where do you get your information? You said CDC, and where else can people go to?
The CDC is a great source. John Hopkins University, and there are other universities, but they're pretty good. NYU has a pretty good source, I think, in Langhorne.
Okay.
But mine are CDC, John Hopkins. I like to look at the New York Times map because they give me just facts.
Okay.
Google also has a map of known infections that they show you. Or I think it's around the world. The Times is. I don't see why Google wouldn't be around the world. But again, just give me info and just basic stats so you can see. I just want to see that, like I explained earlier.
Yeah.
I want to see the acceleration slowing down. That gives us a pretty good idea. And if you go back and assume and you see how I'm already starting to do all these little gyrations in my own head, if you look at the way the Chinese curve has flattened and look at that, okay, are we seeing the same thing? We're behind them now. Mm-hmm. Can we put that template over the other? Oh, look, we're heading in the right direction. Is that going to give us any comfort, any proof of any sort? Maybe, maybe not.
Yeah.
It's just, right now it's all observation and informational gathering.
What's with the people buying the toilet paper? Do you know why they're doing that?
That you're better off talking to a psychiatrist, not me. That one, that's hilarious.
So you don't know?
Well, they're buying it because they're afraid we're going to run out, and why they chose toilet paper over batteries or something else, I have no idea.
Okay. Isn't that weird? That's so strange.
Well, and that one's somewhat understandable that we had a shortage, in the sense not that people are doing interesting stuff, but toilet paper is a commodity that's going to be made. People aren't going through seasonal pooping episodes, right?
No.
So you're not going to be prepared unless these guys would, and I don't know why any manufacturer would necessarily stock toilet paper, but they're going to be supplying the same amount of toilet paper throughout the year, right? So if everyone grabs it at once, they don't have a mechanism to replenish it, so they're just going to keep plodding along.
Yeah.
I saw some calculations recently where there's a joke where Jim Smith, in the year 2003, January 13th, it's a special day because Jim Smith is using the last roll of toilet paper that his parents bought in 2020.
That's right.
It makes no sense.
Okay.
It's a lot of emotional stuff. We're humans. We do some funny stuff.
So weird. Right? Okay. Doc, thanks so much for giving us your take on this whole thing.
Well,
today.
I hope it's valuable. It's just my take. Like I say, I'm not an epidemiological expert or anything like it, but I do know a little bit about medicine, more so than the average person and stats. So I hope it's helpful.
I'm sure they'll be happy to hear from you. Thank you, Doc.